Yeah. Good morning, everyone, and welcome today on this session of Polycystic Ovarian Disease brought to you by Apollo Cradle. To speak on this topic, I would want to welcome Dr. Shilpi Sachdev. She is an internal consultant associated with Apollo Cradle with Motinagar Center. To give a brief background about our Dr. Shilpi Sachdev, she has done her MBBS and DMB in Obs and Gynae. She's done her FMAS, DMAS, and MNAMS, and she's a senior consultant gynecologist specializing in high risk pregnancy, a laparoscopic surgeon, and an infertility specialist. Today, we're going to hear from Dr. Shilpi Sachdev about what is polycystic ovarian disease, what are the things that we should take care of, and what things we shouldn't do, and what are the treatments available. So, we all are eager to hear from you, ma'am. Looking forward to have such a wonderful session from you. Thank you.
Yeah, so thank you and good morning. A warm welcome to all of you. So, as already told by Aarti, that I'm going to discuss about PCOD. So, you must have heard very commonly about PCO. Nowadays, the girls come to our clinics and they tell us by themselves that, Doctor, I have PCO, or my PCO was diagnosed 5 years back, 10 years back. So, people are quite aware of it, but still, there are people who don't know about it or they don't know actually what it is. So, I'm here today to clear all your doubts and to just give you a basic review of PCO, what it is, and how we can treat it, at a basic your level, what we should do and what we should not to avoid this PCO condition going worse. So PCOD is very common nowadays. It affects 8 to 10% of our general female population, and the incidence is increasing. What we are seeing nowadays because of our lifestyle. And in infertile ladies, the incidence is as high as 20%. So we should, address and know what is PCO. So before starting PCO, I should tell you that what is normal function of the ovary. So PCO, stands for polycystic ovarian disease. So it is something related to ovaries. So, in a female, in the reproductive tract, we have a uterus in center, then we have two tubes on the sides, and we have ovaries on each side. Now, every month, from one of the ovaries, a egg is released. One egg starts forming from day one of periods. It gets matured by approximately 14th day, and it gets ruptured. So there is ovulation. This is called ovulation. This egg is picked up by the tubes, and the fertilization, if happens during that time, it happens in the tubes, and this embryo, the zygote which is formed, it comes and implants in the uterus. This is the normal process. So inside the uterus, then pregnancy grows, and if suppose the pregnancy is not happening, then the lining of the uterus sheds off in its own by as a cyclical in a cyclical manner, which happens approximately say 28 days, 30 days cycle. So normal cycle is around 21 days to 37 days. In few it can be short, there can be short cycles like happening in 21, 22, 24 days, and in others it can prolong up to 37 days. So this is considered as normal. But what happens in PCO is that single egg which should mature is not happening. Multiple small eggs are present in the ovary, which are arranged peripherally. So the one of these do not grow and mature, and multiple start growing, and they are in a static manner. They don't mature. So the ovulation is not happening, the egg is not rupturing. So hence, the if egg is not coming into the tube or the fertilization is not happening, so the pregnancy also does not happen. And because of this hormonal, why is this happening, that multiple eggs starts growing and not a single one matures and there is no ovulation? It is all because of some hormonal effect. So the hormones are coming from the brain, hormones are coming from the ovaries, from the adrenal gland. So these hormones, you know, they impact on these ovaries, and this disturbance happens. Now, if the egg is not releasing, so and the hormones are disturbed, so the lining of the uterus also does not shed off in a monthly way. And the symptom which most commonly the PCO ladies feel or suffer from is oligomenorrhea, or what we call as delayed periods. So the periods are not happening in time, they are delayed, say happening maybe 40 days, 45 days, 50 days, 60 days, or they may go on. They do Periods do not happen for 3 months, 4 months, 5 months. Even this scenario also does happen, or the periods occur only after taking certain medications. So this is how you can, differentiate. So anybody who's suffering from PCO, how would you know that I am suffering from PCO or I am not suffering from PCO? So the first and the commonest symptom is delayed periods, because ovulation is not happening and there is disturbance of hormones. So delayed periods, the flow might be less, or if the periods are happening after 3 months or 4 months, the lining of the uterus by that time thickens to certain extent that it bleeds heavily. So you can have variety of symptoms in menstrual irregularities. Sometimes there can be very frequent periods also. Commonly is delayed periods, but frequent periods less than 21 days cycle can also happen in PCO. So delayed periods, frequent periods, irregular periods, and periods with heavy flow or less flow. These all can be symptoms of PCOD. So if any one of you is suffering from this, you should know, and you should suspect that why is it we should investigate that whether I am PCO or I'm not PCO. Now, this is one of the symptoms. Then other symptoms which are generally seen are the female has more of male pattern of hormone in the body, which leads to acne. So the young girls, or so any female in the reproductive age group has acne on the face or on the back. And another sign of increased male pattern hormone is excessive hair growth. So this hair growth can be on the face, chin, lock areas, or around the breast. And these hair are not very soft hair; they are coarse and dark hair. So excessive hair growth and acne is a sign of excess male pattern hormone in the body, which also is a symptom of PCOD. So definitely, if these symptoms are there, like if the female has acne and hair growth is too extensive, we must rule out that associated adrenal problem is not there. We have to rule out any adrenal cause. Then third is that you go for ultrasound for any other reason, say for any pain abdomen or any other symptom, and you're getting a routine checkup done, and there the sonologists tell you that you have PCO, that your ovaries are looking like PCOD. So as I have told you earlier, that how the look of PCOD is that the eggs are arranged in the periphery, multiple small eggs, none of them are maturing, and the center of the ovary is very thick. So thickened stroma, multiple small sized eggs which are lying in the periphery, around say 12 follicles in number. And the ovarian volume is more. So it is, if it is more than 10 cc, we take it as PCOD. So these three symptoms, what I've told you, one is periods irregularity, other one is acne, hair growth, male pattern of hair loss. So if a female is having hair loss in this area, that is also a sign of PCO. Sometimes, the signs of hormonal imbalance and obesity is there is blackness in the neck area. So this is also one of the symptoms seen with this hormonal imbalance. Now, out of these three, if two are present, so what are these three? Or menstrual irregularity, periods problem, the excess male pattern hormone symptom like either acne or excess hair growth on unwanted parts, and then ultrasound showing a picture of PCOD. So if two of these three features are there, then it is diagnostic of PCOD. Be diagnosed. So only ultrasound is not diagnostic. The ultrasound says that you have PCOD. It is not confirmed. If you have any symptom along with that, or your blood test are indicative. So in these, the certain blood tests are also indicative of PCOD, like the hormones which are released from the brain, from the there are two organs in the brain, hypothalamus and pituitary. If LH and FSH hormone disturbance is there, if the insulin is more, or the insulin resistance is there, then these hormones, they cause all these disturbance. So these, what we have discussed is that in the general population, if you have to categorize yourself whether you are PCO or you are not PCO, so this is the symptomatology where you can define yourself. Now, let's come to that. What is the cause? Why is it happening so frequently nowadays? So, the causes are, first of all, I told you that the hormones which are coming from the brain, from hypothalamus, pituitary, and these hormones from the brain, they act on the ovaries, and then ovaries also produce certain hormones. So, if there is a disbalance in this excess, then there is a problem. Now, why this disturbance is happening in certain females? One is genetic predisposition, that we have a gene. If that is there is a problem in that gene, then there is predisposition to this PCOD. Then second is lifestyle. So lifestyle is playing a very major role nowadays, and that is why the incidence of this is PCOD is increasing. So physical immobility and dietary patterns, the way we eat, refined foods, not eating healthy food, and eating junk outside, sweets and beverages, and all the junk available. So, and then stress pattern, not no physical activity, sitting throughout the day. So these are leading to this problem is leading to PCO. So the incidence of PCO is increasing. You can see in young girls, especially in COVID time, we have seen that people are just sitting at home and there was no physical activity, and this PCO, they have suddenly gained weight, and this PCOD problem is increasing. So what happens is, when you gain weight or there is obesity, so there is central obesity, and this leads to insulin resistance. Now, what is this insulin resistance? Insulin is a hormone which is released by organ called pancreas. You must have heard about it. Like in diabetics, we hear that sometimes, they take insulin to regularize their sugar levels. So what happens is, in a normal individual, I'm not talking about a diabetic, normal individual, when we take in glucose or we eat anything, when we consume calories, so this glucose which goes into our blood, this glucose has to go inside the cell for utilization or energy production. Now, this glucose can only go inside if the insulin gives the permission to go inside. So insulin, as soon as the blood sugar level rises, the insulin also is released from the pancreas. So insulin goes to the cells, and there is a receptor on each cell, which is called insulin receptor. So this insulin acts on this receptor, and it acts like a opening a lock system, and it internalizes the glucose. So glucose which is present in the blood, it opens the lock and takes the glucose inside. Now, if there is resistance at this lock level or insulin receptor level, So insulin is there in the body, but it is not able to act on this receptor. So there is some problem in this lock mechanism. At the cell level, insulin is resistant. So the receptor is not responding to this uh, this insulin. And so the glucose cannot be internalized. It cannot go inside the cell for its body's metabolism or energy production. So what happens in the blood? The glucose level starts rising. So that's why PCOD is a pre-diabetic condition, because your blood sugar levels start rising. Also, the insulin is not able to go in, it is there in the blood only, and the insulin level also is high. So, obesity leads to high sugars because of this insulin resistance, and insulin level also in the blood is high. So, overall metabolism is affected, that it just does not affect the reproductive organ. So, we don't say that it is a disease which affects only the ovaries or only the uterus and it is only associated with reproductive function. No, so it is associated with all the whole body system. So that is why there are these PCO, if they are not managed properly, it leads to diabetes in future, it leads to heart disease in future, it leads to dyslipidemia. So your cholesterol levels and your lipid would become deranged. Your cholesterol level would increase. So it would then lead to hypertension, that is high BP. And so these are the general, like diabetes, hypertension, heart disease. Cholesterols are high, so leads to again heart disease problem. And as the lining of the uterus keeps on increasing, as it is not shedding in a monthly way, and it keeps on thickening, also the hormone, this estrogen hormone is increased in this in these PCO patients. So the lining of the uterus keeps on thickening. So long term, these hormonal effects can cause endometrial cancers in these PCOD patients if left untreated. Okay, so this is a multi-system disorder. That is why we call it as PCOS. That is, it becomes a syndrome. So syndrome includes all that you have this reproductive organ or your periods problem and your cosmetic, hair growth, acne, not able to conceive, infertility, obesity, and leading to diabetes, hypertension, dyslipidemia, that is high cholesterol level, heart disease, endometrial cancers, breast cancer. So these are all increased incidence seen in case of PCOD if left uncared for, if not taken care. So this is I dealt with your causes, that why it is happening. It has some genetic cause and it has lifestyle disorder. So lifestyle disorder, not sleeping in time, not getting up in time, not eating in time, and whatever you are eating, you're eating more of refined sugars, you are eating more of fats, outside food, junk food, sugars, free sugars intake, and too much of stress and not moving, no physical activity. These all lead to the problems. So we have dealt in symptoms, we have taken care of the causes. Now how can we treat, or how to avoid? So as we have a genetic predisposition, so it is, in few females it is there in the dormant stage, it will be there in your body. But once you are under stress, you are not eating well, you are not eating good, you are not doing any physical activity, your cycle is disturbed, you are not sleeping in time, you're not getting up in time. So and you have gained weight. So then this dormant thing which was there inside you becomes active, and then you have all those symptoms. So how do we treat that? So the answer is in this only, that if we avoid all these things which are causing the problem, we can find the solution to it. So we have to be more active, we have to be mobile, we have to exercise daily, we have to eat healthy. That's the most important thing. So eat non-refined food, refined foods, avoid sugars, white sugars, avoid free sugar intake, avoid fried food, avoid junk foods and bakery products and breads. So eat healthy and do exercise. So this is definitely going to help. So even 5 to 10% of weight loss in obese female does help a lot in bringing down the symptoms and in reversing the process of PCO to much bigger extent, right? So that is one thing. Now, depending upon your symptoms, we treat. So this was the generalized weight reduction, physical activity, diet control. Now the next is that if you have symptoms of acne, we can give you some hormones to reduce the male pattern of hormone. We have some anti-testosterone hormones which we can give, and the hair which hair for hair also the treatment is like anti androgens or anti male pattern hormone. We give some oral contraceptive pills or we give some progesterones like that. So if the hair which are already there or the scars which have already happened, so for those you have to go in for cosmetic treatment. So the hair which are already there, they are not going to go up, though the quality of hair would definitely become less coarse or little soft with the treatment. And if you go in for laser or some other cosmetic procedures, this that is going to make a difference in your cosmetic treatment if along with that you are taking certain medications. So cosmetic treatment is the treatment for your already existent hair growth, but yes, to reduce the further increase or so that further the new hair doesn't come, so you have to take some oral contraceptive pills or some anti-testosterone hormonal treatment. Then next is if you are like suffering from after this that hormonal, if you're suffering from periods problem, if the periods are not regular, then we can again give you oral contraceptive pills, we can give you progesterones, we can give you Mirena, that is hormonal releasing device inside if your periods are too heavy or they are too irregular. So we can do all that. And sometimes if the female is now trying to conceive, not able to conceive, now the cause is that she's not ovulating. Maybe it is happening that the hormones are not good inside and she is not forming egg every month. So we can assist in that also. So general thing which I already told you: weight reduction, physical activity, diet control. And if the problem is of conception, then we can assist by giving some medicines to form eggs. We can give injections for the formation of eggs, and or we can do some procedures in these, and we can assist by doing IUI. Or if not able to conceive, then that's a different issue. So basic thing is that. And sometimes we do ovarian drilling also to reduce the androgen load, that male pattern of hormone, the load which is high in the body. We do the drilling, which is a laparoscopic procedure, and it reduces the load. And suppose if we are we have progressed further, and the lining of the uterus has thickened, and I already told you that we have hormones, and we have hormonal releasing device called Mirena, which can be inserted inside, and it opposes the action of unopposed estrogen, which is causing the thickening of lining of uterus. And then treatment of obesity is that we have anti-obesity medicines. Then treatment of diabetes or pre-diabetes, so we have medicines to control that, and it is a reversible thing. if you maintain your diet and exercise. So this is the treatment, and I hope I'm able to make a difference, and I'm able to create some awareness amongst you regarding PCO, which is very common. And I hope now the people would, make some efforts in changing their lifestyle. And if the problem is still, you feel that it is more, you can take medicinal help. So you're most welcome to come to Apollo Cradle Moti Nagar. If you have any queries now, you can ask. So there is one question over here from Aarti, that does every PCO patient show acne and facial hair growth? No, it's not necessary. That is one of the symptoms. Might have only the periods problem, or few might only show on ultrasound that they have PCO, or few come with not able to conceive. So there are different presentations. There are different presentations. So it's not a necessary symptom. Anything else?
No, ma'am, no more questions. I mean, only one question was there, which I guess you answered. So you have covered in
Things
detail.
have become very clear, that means.
Yeah, I mean, PCOS people do read in there. I mean, you have covered in so much of detail and so well spoken. So we no questions. But I'm sure if there are any, they would send a message on the link.
Sure, sure, sure.
Yeah. Ma'am, any final tip or any final message that you want to say that they should take care of to avoid having PCOD? We can say that.
Yeah, so final tip and the gist of all is lifestyle management. So healthy lifestyle, I would say, is the best thing to do, and that is with diet and exercise.
Thank you, ma'am. Thank you so much.
Yeah, thanks for
Yeah.
patient hearing. Yeah,
Oh, no, ma'am, it's a wonderful session. Thank you so much.
yeah, I also enjoyed. Thank you so much. Thank you.